Hello there everyone! Welcome to a brand new video of GG Care. In this video, you'll get to know the top 10 types of dementia so you understand the necessary steps to take care of your loved one who's struggling with dementia. But before anything, let's answer the most frequently asked question: is dementia a disease? No, dementia is not a disease at all. Dementia has a wide-ranging connotation referring to the shortfall of cognitive operation of the brain that affects your memory, thinking and reasoning abilities, mood, behavior, and overall personality. Memory loss and judgment becomes so severe that it hinders your day-to-day life and actions. It's estimated that about 55 million adults worldwide have dementia. 50% of people aged 85 years and above are diagnosed with acute to mild symptoms of dementia. Current therapies and medications can help manage the symptoms to a certain extent. GG Care has employed modern technology to develop a highly sophisticated voice app that can convert your Amazon Alexa appliances into a virtual assistant for dementia patients. GG Care app enables dementia patients to live their daily lives safely and independently by reminding them of their daily schedules and appointments or helping them to do everyday tasks smoothly. The first and most important thing one must understand is that dementia is not a disease or an infection, but a state in which the mental functioning of a person declines. Dementia affects 3 areas of the brain, including language, memory, and decision-making ability. The symptoms of dementia may vary from person to person and manifest in different ways. Therefore, a dementia patient most commonly finds it difficult with the following activities: memory, thinking, reasoning, motor skill coordination, language, mood, and social skills. Patients with dementia also undergo specific psychological changes such as confusion and disorientation, personality changes, depression, anxiety, agitation, delusions, and hallucinations. It's essential to recognize the earliest signs of dementia and to initiate the best care. It's necessary to identify the particular type by analyzing the specific symptoms. Here are the top 10 types of dementia. Number 10. TBI or traumatic brain injury. This type of injury is caused primarily due to repeated blows to one's head. Soldiers, athletes like football players, boxers, and a person who suffered a severe head injury in a vehicle accident mainly undergo traumatic injury dementia. The symptoms of this type of dementia may take years to surface. The symptoms vary from person to person depending on the area of the brain that got hurt. Significant symptoms include depression, memory loss, mood changes, explosiveness, headaches, slurred speech or impaired speech, and behavioral transformation. Number 9. Wernicke-Korsakoff syndrome. If you have vitamin B1 or thiamine deficiency, you can suffer from this brain ailment. It can be seen in persons suffering from any chronic disease or malnutrition. People who indulge in drinking excessive alcohol are more prone to this disease. The key symptom includes bleeding in all major brain areas that control our memory. Other common signs of Wernicke-Korsakoff syndrome are a decline in cognitive abilities such as thinking, problem-solving, remembering, processing information, and adopting new skills. The person also suffers from poor muscle coordination, double vision, weak motor skills, and most importantly, memory loss. Number 8. Creutzfeldt-Jakob disease. It's a very uncommon infective brain ailment that affects only 1 in a million people. When an irregular protein called prions creates a clump in your brain, you suffer from this disease. The prions cluster together, which causes the decay of the brain's nerve cells. The person affected by this rare disease may have symptoms like inability to think, loss of memory, lacking communication skills, skills for planning and judgment, anxiety, confusion, behavioral changes, and depression. Number 7. Parkinson's disease. Patients in the advanced stages of Parkinson's disease can show signs of dementia. These symptoms may range from thinking inability and loss of memory to hallucinations and delusions to depression and speech issues. If your loved one is diagnosed with Parkinson's, be vigilant to identify the signs of dementia at the earliest so that proper care can be offered. Number 6. Huntington's disease. This type of dementia is caused due to genetic mutation. A single faulty gene is a culprit behind this disorder that causes a breakdown in particular nerve cells in your brain and spinal cord. This eventually causes a severe decline in body movement and motor skill control, impaired thinking and reasoning skills, memory loss, and trouble in decision making. Inappropriate behavior and abrupt personality changes are also noticed in a person suffering from this disease. The symptoms of Huntington's disease are evident among young people aged 30 to 40 years. Number 5. Mixed dementia. In this type of dementia, the person suffers a blend of 2 or more types of dementia. The most common combination is the blend of vascular dementia and Alzheimer's disease. Mainly older adults of 80 years and above experience this kind of dementia. Due to the complexity of its overlapping symptoms, mixed dementia often remains undiagnosed until its advanced stages. The deterioration of mental functionality in patients with mixed dementia is much faster than the patients of any other type of dementia. In such critical conditions, the GG Care app proves to be highly useful in helping dementia patients by ensuring their safety and providing constant virtual assistance. Number 4. Frontotemporal dementia, FTD. This form of dementia occurs when the frontal or temporal lobes of your brain are damaged due to the deposition of abnormal proteins in this brain region. Sudden or gradual changes in a person's social behavior, mood disorder, change in personality, motor skills, and language skills can be key indications of frontotemporal dementia. FTD is one of the most frequently found forms of dementia among people between 45 and 64 years of age. If you find it difficult to remember everyday things or face problems, try speaking to your specialist at the earliest opportunity. Number 3. Lewy body dementia. When Lewy bodies or small round protein clumps develop in your brain cells, you may suffer dementia. In this condition, your brain's nerve cells are damaged. The primary symptoms of Lewy body dementia entail a lack of body balance and motor skills. The patients may also show signs like memory loss and difficulties in thinking, planning, reasoning, and problem solving. Recognizing the few earliest symptoms of Lewy body dementia, such as visual delusions and hallucinations, sleep disorder, and behavioral shifts, can help you initiate precautions and care for your loved ones. Number 2. Vascular dementia. Almost 20% of dementia patients suffer from vascular dementia, which is chiefly caused by insufficient blood flow to the brain. Sometimes health conditions such as atherosclerotic disease or stroke can damage the blood vessels and block the blood flow to your brain. Memory loss and confusion are some of the most evident symptoms of this kind of dementia. A sudden decline in a person's mental ability can occur after a significant stroke or mini-strokes. Those with high BP, high cholesterol, or diabetes are more prone to vascular dementia. In the preliminary stages of vascular dementia, the person shows mild symptoms like confusion and disorientation, but in advanced stages, the patient faces vision problems and hallucinations. Number 1. Alzheimer's disease. 6 out of 10 dementia patients are diagnosed with this most common type called Alzheimer's disease. Alzheimer's is mainly categorized by brain cell death. When 2 abnormal tau and beta amyloid proteins develop in your brain, you start showing signs of Alzheimer's. These twin proteins snap the link between the nerve cells in your brain. Eventually, it results in nerve cell death starting from one area and gradually spreading. Initially, the patient displays mild symptoms, including short-term memory loss, depression, confusion, changes in personality, and unusual behavior. As more and more brain nerve tissues die, the symptoms become more severe. The person faces difficulty remembering incidents, distant memories, and recognizing persons or places. In the latter stages of this disease, the person loses motor skill control, and many find it difficult even to eat or walk. Alzheimer's disease is mainly seen in elderly patients. About 10% of Alzheimer's patients are above 65 years. Research shows that most Alzheimer's patients have a family history of this disease. The GG Care app can be highly useful in helping Alzheimer's patients cope with their problems at the initial stages. Here are some additional types of reversible dementias that you must know. Certain health conditions can cause dementia-like symptoms, but with proper treatment, these symptoms can be controlled and reversed. Normal pressure hydrocephalus NPH. This condition is seen in patients with cerebrospinal fluid CSF accumulation in the brain's ventricles. The excess CSF buildup damages the nerve cells in the brain. The root cause of NPH can be an acute brain infection, severe brain injury, internal hemorrhage in the brain, or brain injury in the past. Symptoms of this disorder can include poor body balance, frequent falls, attention deficiency, forgetting things, mood swings, and a lack of bladder control. If the signs are detected on time, with the help of modern treatment, physicians can take out the excess CSF from the brain and cure NPH. Subdural hematomas. Internal bleeding between the exterior part of the brain and the brain membrane can occur after someone suffers a bad fall and the blood vessels are ruptured. It's pretty standard in aged people and often shows signs of dementia. Alcohol abuse can increase the risk of subdural hematomas and subsequent dementia. Vitamin deficiency. If your regular diet doesn't include enough vitamins, you could suffer from temporary or reversible dementia. Your daily meal must have enough vitamins B1, B6, B12, and E, or you might start showing signs of dementia. Infections. Various infections, including Lyme disease, UTI, HIV infection, and syphilis, can cause dementia or brain fog. Patients infected with the novel coronavirus have also reported symptoms like temporary memory loss and severe delirium. As several patients of COVID-19 have suffered inflammation and stroke, scientists are investigating the risk factors of dementia as well as the chances of either temporary or permanent cognitive side effects. Various fungal or bacterial infections that may affect your brain and central nervous system can display signs of dementia. Any disease must be wholly cured with prompt and precise treatment to avoid the risk of dementia or any other future complication. Metabolic and endocrine conditions. A few health conditions like Addison's disease, Cushing's disease, hypoglycemia or low blood sugar, hypercalcemia, hyperparathyroidism, exposure to arsenic or mercury, and liver cirrhosis can imitate the symptoms of dementia. Medication side effects. Certain medicines, such as antidepressants and anti-anxiety pills, sleeping pills, non-benzodiazepine sedatives, anti-Parkinson's drugs, anti-seizure pills, narcotic painkillers, etc., have side effects that mimic the symptoms of dementia. If you're allergic to particular medicines, inform your physician and medics beforehand so that your medication should be well reviewed. What should you do if you or your loved ones are diagnosed with dementia? If you or your loved one shows symptoms and is diagnosed with a particular type of dementia, you mustn't panic or lose hope. Keep your calm and help the person in the right way to cope with the situation. Provide help to the person to stay calm, keep the daily use items handy and well organized, ensure their safety, talk and try to understand the need of the person. Help to recollect or find the things they keep on forgetting without letting them feel too dependent or helpless. Try to regulate their sleeping hours and make them comfortable. Involve them in engaging, entertaining, and stimulating activities. However, it would help if you remembered that not all dementia patients exhibit the same symptoms. Memory, communication, and cognitive impairments are the most prevalent symptoms of dementia. Diverse kinds of dementia have different origins, and their effects on cognitive, behavioral, and physical functions vary. Also, the symptoms of Alzheimer's disease, the most prevalent type of dementia, develop with time. You must consult your healthcare practitioner if you or a loved one are suffering memory issues, difficulties doing routine chores, or mood or personality changes. Once an appropriate diagnosis has been made, therapeutic alternatives may be considered. Lastly, visit our GG Care website to receive the best virtual assistance for dementia patients. Setting up and using GG Care is simple and can be easily operated by patients independently. Hope you found this video to be helpful. For more information, please visit our GG Care website for more details and subscribe to our channel. Oh, and don't forget to share this video with your friends so they too become aware of the different types of dementia and help out their loved ones.